Cardiac catheterization. Cardiac catheterization, coronary artery disease, pulmonary artery pressure, coronary artery disease, coronary artery disease, and pulmonary artery pressure, Treatment, medical treatment of mitral stenosis, medical treatment, and intervention and surgical treatment. Medical treatment, intervention and surgical treatment. Medical treatment: if atrial fibrillation, if features of pulmonary congestion. If atrial fibrillation, anticoagulant therapy. Anticoagulant therapy, example, warfarin and restoration of normal rhythm. Warfarin and restoration of normal rhythm by digoxins or beta blockers, or rate limiting calcium channel blockers, or other antiarrhythmics drugs. If features of pulmonary congestion, then use diuretics. Intervention and surgical treatment. Treatment options are mitral balloon or valvuloplasty, mitral balloon or valvuloplasty, then closed valvotomy, and mitral valve replacement. The complications of mitral stenosis. Complications of mitral stenosis: atrial fibrillation, systemic embolism, pulmonary hypertension. Right ventricular failure, pulmonary edema, pulmonary infarction, chest infections, hemoptysis, coughing out of blood, infective endocarditis. Mitral stenosis dilan. Aortic regurgitation, aortic stenosis, and aortic regurgitation. Next important topic is aortic regurgitation, AR of 1. Aortic regurgitation. Management of aortic regurgitation includes clinical features. Clinical features include symptoms and signs. Symptoms: mild to moderate aortic regurgitation, often asymptomatic, and palpitation. If it is severe, then breathlessness and angina. Signs: bedside signs, pulse and BP, murmurs and other signs. Pulse and BP: large volume, collapsing or bounding pulse. Pulse and BP: pulse and BP, large volume, collapsing and bounding pulse, low diastolic and increased pulse pressure, capillary pulsations in nail bed, capillary pulsation in nail beds, Quincke's sign, this is called Quincke's sign. Then femoral brood or pistol shot, femoral brood or pistol shot, femoral brood or pistol shot, it is called Durosis signs. Durosis sign. Head nodding with pulse. Head nodding with pulse. This is called de Musset signs. De Musset's sign. Pulse and BP done. Pulse and BP. Then murmurs. Early diastolic murmur. In aortic regurgitation we get early diastolic murmur. Then systolic murmur, increased stroke volume. Systolic murmur increase stroke volume. Austin Flint murmur. Soft mid diastolic murmur in the mitral area. Other signs. Include displaced thrusting apex beat or volume overload apex beat, then pre-systolic impulse, third or fourth sound, then crepitations, pulmonary venous congestion. Investigations in case of aortic regurgitations. Number 1, ECG, chest X-ray, echo, and number 4, cardiac catheterization. ECG shows initially normal, later left ventricular hypertrophy. Chest X-ray shows cardiac dilatation. Maybe aortic dilatation. Features of left heart failure. Echo, dilated left ventricle. Hyperdynamic left ventricle. Fluttering anterior mitral leaflet. Doppler detects reflux. Cardiac catheterization, dilated left ventricle. Aortic regurgitation, dilated aortic root. Treatment may be required for underlying conditions. Conditions such as endocarditis or syphilis. Aortic valve replacement. Aortic valve replacement is indicated if aortic regurgitation causes symptoms, and this may need to be combined with aortic root replacement and coronary bypass surgery. Asymptomatic patients should be followed up manually. Systemic blood pressure should be controlled with vasodilating agents such as nifedipine, dilating agents or drugs such as nifedipine, or ACE inhibitors, nifedipine or ACE inhibitors. When aortic root dilatation. When aortic root dilatation is the cause of aortic regurgitation, Marfan syndrome. When aortic root dilatation is the cause of aortic regurgitation, Marfan syndrome's aortic root replacement may be necessary. Regurgitation is the cause of aortic regurgitations, Marfan syndrome. Marfan's syndrome. When aortic root dilatation is the cause of aortic regurgitation, example aortic regurgitation, example Marfan syndrome, aortic root replacement may be necessary. Aortic root replacement may be necessary.